Okay, we shall call the meeting to order. And get started. Good morning, good evening, everybody. It's been a long day. We have a good amount of people here, so definitely a forum to get started. I do have coffee in my car, I'm gonna switch to water. Okay, do we have anyone for privilege of the floor today? No, no one submitted anything. We do have minutes that were distributed to everyone prior to the meeting and are in your packets. If you can take a brief moment and look at them.
Actually, didn't read it.
And
Okay.
upon reviewing, can I get a motion to approve the minutes for May 16th?
Second.
There were no issues or redundancies, anybody?
You did have, you did have one. Don, yeah, Don was left out on there, but we'll edit that.
Okay. The one.
I didn't see my name, but I wasn't here. So I can.
The list you under, is there an action list?
Yes, so they should be listed and it should be, and it should be excused.
The other thing I have, which is a stupid question, is under the preschool transportation. It said New York State has been involved in conversations to help mitigate.
That's probably just a typo. So, mitigate, I'm sure it should be. We'll get that changed too.
All right.
Okay, so we have those three changes. Does the motion still carry? Do we need to do another one? You good?
Yes.
All right. New business. Agreements to settle.
Hello, everybody. So, unfortunately, we again have some public water supply violations. Folks not submitting monthly results, not submitting monthly reports. And then we start with the folks who have single violations, and then the next section is a couple of facilities that have multiple violations. The first facility listed under the topic of public health supplies with multiple violations is actually also going to be talked about in our facts and findings if they went to hearing, because this person or this facility, unfortunately, we're afraid that it is becoming a pattern of behavior, not just a occasional misstep. So we brought them in for a hearing, so I can talk about that when we move on to the next section of things. But otherwise, unfortunately, what we see time and again, folks just have missteps or don't follow through. We did have one, a TUPA violation that did settle, and agreed to settle because they did sell a product to an individual under 21 years of age. So this was their first violation, so they paid the minimum of the $300 violation fine plus the $250 required surcharge. And then
Out of curiosity, how many agencies are you following? What's the volume?
how many permitted facilities? Oh,
Ballpark.
public water supplies, we have 256 public water supplies, and that ranges from, like a mobile home park campground to a restaurant that has their private well kind of situation. So yeah, I'm pretty sure the number is about 256 for that. facilities selling tobacco products. I'm not positive of the number. I want to say that it's around between 25 and 30. Again, I'm not positive of that number. I'd have to double check that, yeah. I mean, then there's a whole bunch of other facilities that aren't represented here, all of the other permitted facilities that we do inspections for, you know, campgrounds, mobile parks, restaurants, all of them.
Yeah.
And they do have inspections, and occasionally we do issue violations on those facilities as well. Yeah. No, I mean, I can get you those numbers. It's a lovely chart. Yeah, there's a lot. It's one of those things, you know, we always joke that a lot of folks don't have any idea a lot of folks in the community don't have any idea who we are and what we do because they don't know about us until there's a problem, you know? So most of our facilities are, you know, they're doing the right things. They have some missteps here and there, but most of the time we do our routine inspections with them. They do their routine monitoring, and we don't have to elevate our relationship. Unfortunately, for some of these facilities, we do.
We don't need to take any actions on that part, right?
Nope, the agreements to settle are the folks who have been issued violations. They have acknowledged and signed that document agreeing to pay the fine and essentially admitting that, yes, they did what they were cited for. There were these three situations that did actually go to hearing. So the first situation in front of you is the one that I referenced in the public water supply situation. Unfortunately, this facility, hold on, let me pull up my actual data on this facility. Because we have noticed that this facility seems to have a pattern of behavior, we did require that they come into hearing, so we didn't give them an option for an agreement to settle on that second violation. Unfortunately, although they were very aware of when the hearing was, what time it was, all of the things, and we did speak with them ahead of time, they did not show up for the hearing. So we presented, you know, our side of the situation, our side of the story in front of the hearing officer, and she heard what we said. And, you know, you can read in her facts and findings. She acknowledged that in this particular instance, it was the second violation in the calendar year of 2024. So the hearing officer recommended a fine of $200 for this violation. I would just like to remind the board that you folks are able to bump that up if you feel it's appropriate. We put together a little bit of a timeline of these monthly reports that this particular facility has been neglectful on. And of the past 13 monthly reports that should have been submitted on time, only 6 of them were.
What's the cost of testing?
So this wasn't for testing. This is just monthly reports. So they have a sheet of paper. Every day they're supposed to fill out that they checked their chlorination system and what the level of that chlorine reading was.
Okay.
And by the 10th of the following month, they need to get us that monthly
So it
report.
costs them nothing.
That's correct.
Did you hear after the hearing, I read and you said they didn't show up? Did they, well, the next day or anything and apologize? So they just continue to blow you off, basically?
Yes.
So they could just be ignoring all the chlorination though. They could be not doing anything.
There's
that
a
part
term for
would-
that. It's called scofflaw.
Yeah.
That's what they are.
Yeah, so they could have a nasty water supply. And that would cost them money though. to get
If
fluoridated.
they're sampling and showing us that they have a nasty water supply and we catch it, yes.
Yeah, so the safety net there is that then there is also the water testing, but that's assuming then that they're doing water testing properly and samples are taken properly and.
And so what we're afraid of is that, and I'm certainly, I don't have any concrete evidence with which to support this, but we're afraid that this operator may be seeing our $100 fines as essentially their cost of operating and not paying for a water operator to actually be maintaining and monitoring the system. Like I said, that's why we brought them in for hearing, because we wanted to share that that was our concern and make sure that that's not the situation that was happening. Unfortunately, they didn't come, so they weren't able to present any other reason.
And people live there, right? At these apartments?
If we were to raise the number, any number, or even the $200, and they don't pay it, what happens then?
Well, with a water supply, so if it's a permitted facility, we can pull a permit on a permitted facility. If it's just a water supply, honestly, there's not much we can do other than perhaps the public health director taking steps to not condemn, but to placard a facility saying that it's unfit for human habitation.
People read this stuff in the media too, and it can be real good for business.
Can we go in and test?
I mean,
stuff,
we can,
Get a order, whatever.
I mean, we can go in and test just as, I mean, I can go, not to be crass about it, but I can go in anytime I want and say, we're here to monitor, to check, to, survey your system. The hope is that people are taking care of things and we don't have to do
Well,
that.
I mean, if we think the water's unfit, then
Yeah, I mean, we can go in, because we do take routine samples of all of these facilities. We'll take a surprise pop-in sample at some point during the year. And if it is a facility where we're concerned that the operators maybe aren't doing the right things or aren't, sometimes the new operators needed a little extra hand holding to get the swing of things. We'll
She's
make
not a new
frequent,
operator.
she's not a new operator,
Can
no.
you describe this facility? You're calling it a facility, what is it? It's a trailer park?
It's motel, isn't it?
It's
It's a
it's
motel?
an apartment motel situation, so
How many
they have
units?
short term. Yeah,
I personally think fine should be higher, a lot higher, especially since they didn't show up in court. And we're wasting county resources with the county attorney.
I thought we talked about that 2 meetings ago.
Yeah.
Raising.
We were trying to get a sense of what the cost is to the county to have a hearing and reflect that in some of the fees that we.
so,
Well, we know the fees have recently gone up.
well, and so our Board of Health hearing officer, is paid $100 an hour for their time, plus the mileage to travel to Mayville, to hear the case. And there is a minimum 2-hour, time period that we pay them anytime they come to do anything.
It's $200 plus mileage.
Plus the time that they then take when they take all of this information home and put it all together in a report. So 4
Plus
hours.
staff time that may have to come. And then,
And $200 isn't much, like you said, they, fine.
right. And some of, again, and we'll actually talk about this a little bit more when we get to part of the director's report, but part of the concern with patterns of human behavior is that operators that are very familiar with these systems could very easily roll these forecasted costs into their budgets of operation, specifically if there are tenants that are paying fees to them. That cost could very easily be rolled over to a tenant fee. And if it happens to be a certain Section 8 housing or HUD funded apartments, then really that's a double doozy to the taxpayer and to. So there's some opportunities there. But yes, this is in particular to this case. You would, as the Board of Health, have the opportunity to raise this particular.
Is there a maximum?
Is it 2,500 for this one? We can actually,
Yeah, I have to look into it. We've
There's
never,
gotta be.
there is a maximum. I'm not sure.
it would be
Yeah.
the sanitary code. So yeah, there is a maximum. I think it's typically if it's, because this would definitely be a second fine at least.
Well, I think we can set rules within the sanitary code for the county, but ultimately we're enforcing the state regulation under Article 10 or Part 10. Yeah. So I'd have to verify what the maximum is, but it's definitely thousands.
So,
Do you need a motion? I guess for the purpose of getting something on the table, at least, I'd like to recommend $500.
I'll second it.
Is a part of this only money? We can't say and random drop in and check the water supply for safety purposes.
You can set parameters that you would like us to follow. I mean, if you would like them to submit a water sample immediately, if you would like to set that sort of thing to,
I mean, I think we should because the basic issue here is safety. Can we add that to the motion?
For sure. And, yeah, because I think part of it is I heard what's 7 out of 13, 6 out of 13, one or the other.
6 out of
We're
30.
delinquent. I mean, it's maybe this calendar year, but I mean, and I just want to get it on the table. If people want a higher number, that's okay too. But, discuss it and look at it. We need action. So throw that out. If someone wants higher, let's just want to get it out there.
They just didn't come to court. They just ignored.
Yeah.
Yeah. So I think.
We have others, though, when you read the cases, others who didn't show up too.
mhm.
And that's
Mhm.
quite surprising. to me.
Jessica, in the letters sent to these folks, is the maximum fine listed in that letter?
No,
That
we
you
don't.
May be, or sort of a warning that you may be fined up to a certain amount, consistent with the sanitary code at all.
We don't list the maximum. We do state that this is the fine that we would be willing to accept your agreement, your signed agreement to settle. And we do have the statement that says if this goes to fine, that the Board of Health may determine the fine to be larger than this minimum.
I'm just thinking for the repeat offenders, should that language be a little bit stronger? You say that, under the sanitary code, the fine may be up to X amount, whatever that amount may be, and say, it's serious business. And
Yeah, we can absolutely do that.
maybe a little lighter first time, because we all know that things are forgotten. That happens, but
Frequently, the very first time,
Yeah.
we don't do this at all.
Right.
Yeah.
How many times have they been in violation?
So, yeah, with regard to monthly reports. Sorry, the computer just went to sleep. With regard to monthly reports of the past 13, only 6 have been submitted on time.
That should be noted, I think, in the letter to them also.
Yeah.
I mean, it's,
and as far
less than 50% have been done in a timely manner.
as far as sampling.
Board is very
how many times
concerned.
are
Their bacteria samples and their nitrate samples have been in good standing throughout all of 24 thus far. And in 23, their nitrate was in good standing and they did miss 1 bacteria sample out of 4. They're required to sample quarterly. So they missed the 2023 first quarter bacteria sample. So since first quarter of 23, they've been submitting their samples.
But you can be sure that it really came from there.
Right.
I mean,
Yeah,
You can say
no
that.
idea where that's.
That's true for everybody though, right?
right, that's,
Unless-
yeah.
You're actually doing it yourself.
Yeah, some of them, some of the facilities do pay us to take the sample because they don't want to be bothered with it. But a lot of them bring their own samples.
What's the cost of you going sample? We could include that.
Sure, we charge $55, so $25 to process the sample, $30 for our time.
I like that. $555.
Yeah,
Well,
or a requirement of the county to go.
So on page 5, of the sanitary code, it says, any non-compliance with provision of such sanitary code may be punished by a fine not to exceed 2,000. And then it goes on to say, in addition, first offense, whatever, there's lesser fine, but they should know that this can go up to $2,000 and imprisonment, 15 days, They're just thumbing their nose in their face right now, because they're getting away.
No, yeah, I mean, if they're allegedly testing the other parts and there's something wrong with the chlorine, they're just don't to disclose that.
Or they couldn't care less.
Right,
Yeah.
or they, yeah.
So where are we at with this decision? We've got,
For the motion, I could, if you had 500, but if it's $55 cost in addition, I think 555. Unless, again, someone wants a different number, we could ask Department of Health to go in and do their own sample. And I like Dr. Burke's comment too about them and other repeat offenders saying that, it could be up to $2,000. And that, you know, it's not just staff.
For each offense.
And this, the board of the Department of Health is very concerned. I mean, it's not, just not minimizing, but just staff, it's been brought to the board. The board is very concerned and it's like, they write the letter and we'll be following it closely.
and we
Something like that.
require an immediate sample submitted. I guess you guys would go in then
To be-
thereafter if they don't.
Yeah, it would be collected. It would be to be collected by county health department, yeah.
I still think it should be 1,500.
If it happens one more time,
Yeah.
it's not gonna be hard to get a higher number.
They don't apply.
Okay, I think that's a motion.
Yes, that's what it's true.
Do I have a second?
No.
Did you second it already? You did the first one earlier. You second the amendment?
Second the amendment.
All in
There's
favor?
another part to this, which is getting back to that. No person shall refuse to allow the public health director and or his or designee to inspect land. So you have every right, according to the century, to send someone without, problem. Yeah.
Anytime.
Anyone, all in favor?
All right.
Any opposed?
Can I just suggest if, not part of the motion, but if you don't get an appropriate response,
Mhm.
maybe send the board an email and then, you don't have to wait 2 months.
Okay.
I mean, if you're still getting nowhere.
I got one other question. You have to find, do you know these people? Are they gonna be, can you go in, pass there, is it pretty new in Carroll? You go in some pretty dicey situation.
I haven't personally been to this facility in recent years, but that's not a circumstance that my staff have described to me, it's, yeah.
But perceptive of you because that is something that they consider and have to handle
Yeah.
And
quite
then
often.
you get law enforcement.
Right.
We definitely, yeah, if staff is ever in a situation where they don't feel comfortable going in, we would certainly, our first option would be maybe tag in a coworker, so there's two of us going into a situation. There have been a few situations in which we've tagged law enforcement in. Frequently, they are on sort of complaint follow-up situations where we're really not invited. And we're walking into something where nobody wants to see us. But something like a facility, these folks, you know, although they're not happy to see us, they understand that we can walk in anytime we want or anytime we need to.
Just what about the residents? Did they receive any notification or letter that the owner is out of compliance with the sanitary code? Is that quite a bit of pressure?
It's not something that has been done in the past, no.
Yes, and it's been treated.
Yeah, they are. And they,
But I mean,
yeah. But they may have kids, I mean, you realize,
I know.
this could be, we're most likely nothing, but this could be putting kids at risk, putting elderly people on chemotherapy. You don't know who's there and what kind of other, morbidity or, whatever's going on there. And, they may be,
maybe it would be appropriate for a facility like this, it's just weekly rentals or whatever it may be, but if it's whatever it is, something.
Yeah, I'm wondering if legal might
Probably
review
check it.
something like that,
Yeah.
yeah.
Yeah, we can, something like a mobile home park or something like that would be. So if you're all settled on that one, I'll move on to the next one. The next one is a situation where we went into a tobacco retail establishment, and we, had our 17-year-old with us, and they went in to attempt a purchase of a tobacco product. This particular circumstance, the minor was able to buy rolling papers, which are listed under the New York State guidance as a tobacco paraphernalia. So they should not have been able to buy rolling papers without showing an ID and showing proof of age. Again, they were able to do so. We sent the operator of this facility their notice of violation with an opportunity to sign the agreement to settle. They did not do that. This particular operator did mention that they had health concerns that prevented them from coming into the hearing. So we did have communication with them prior to the hearing, but they did not want to sign an agreement to settle, but also did not show up for the hearing that they were fully aware of. So Betsy heard the case that was presented by our staff in our legal department, and, determined that a sale was in fact made but in violation of the ATUPA regulations through New York State, and, recommended that it's determined the minimum penalty is $300 with that required $250 surcharge, but again, did include in her recommendations what the different standards are for additional violations. This was a first violation.
how many years does that take to reset? I know this isn't the first.
They have to get 4 points within 3 years. Yeah. So the violations come with the fines, but they also include points. And then when a certain number of points are accrued, then we report that circumstance with the evidence to the New York State Department of Taxation, and the facility's license to sell things like lottery tickets can be suspended, as well as their license to sell tobacco products.
Like how many years would pass before this would kind of be off record, caught again, and if it's their first violation, then it's one of the time period.
I guess truthfully, we take it in that three-year stint. Yeah, so every time, so, once, if they don't have another violation in 3 years, then, we reset the clock and,
Yeah, then go to. Boy, the last week.
yeah.
That's fine. Can I recuse myself from the vote if I know the person involved in this? I don't know.
That's not a question, right? Yeah.
I don't know.
Anyone could abstain for any
Yeah.
reason on any vote.
I'm just gonna stay out of it.
So it's 550 total,
Mhm.
2 points is what was recommended.
So the 2 points is a standard set for what this type of sale would prompt under the New York State regulations. So you guys typically don't do anything with the points than to say, yes, we see that this was a sale and 2 points should be issued. Where I've seen the board take action before is with the fine value.
They ask it when a letter is sent to, just reminding the operator about what happens if there's a second one. You know, what it means and I don't know the facility, but to a store like that, I would think lose your ability to sell tobacco and lottery tickets. It may be akin in some stores to closing.
Oh, sure.
Yes.
Sure. That's the reason for being.
Yeah, I mean, so they had to be aware. Whatever so I think the way it's written is it's written pretty well. And maybe that would be in it anyway, and maybe they should know, but I'd remind them, because it sounds serious. As it should be.
So we charge a surcharge on this.
The surcharge is required under the ATUPA regulations. That 250 surcharge is required regardless of first offense. Whatever you guys want to do with that $300, you have wherewithal to do. That 250 surcharge is a standard surcharge.
I was just thinking surcharging water. Case.
Oh,
Again, constantly. The hearing officer and the county attorney. It seems like we should.
that's something we can discuss later when we talk about a
Yeah.
potential fine schedule.
So I'm in a motion to take her recommendation of the fine of $300
Plus the surcharge.
plus the surcharge, plus the point.
Second.
All in favor?
Aye.
Any opposed? Have a abstain?
The next case is another case involving sale of a tobacco product to a minor. This case actually, the sale happened back in the spring. They originally were scheduled for a hearing in April, but we adjourned it upon their request because they had a prior commitment that they were not able to make that April hearing, so we allowed that. However, May date came around, and they did not show up to this hearing. So again, we presented our case. The hearing officer made a recommendation, or she made the recommendation for $1,000 fine plus the $250 surcharge. And the 2 points.
This wasn't their first violation either, right?
I think it's a second.
Yeah, this is the second one for that facility, yeah.
The fine is $1,000 recommended.
Yeah.
And they had no points on the first violation.
Yeah, any sales to minors come with the 2 points.
So this one's gonna be 4 points.
Right,
So
so once the board decides how they want to proceed with this, We'll produce that document. We'll send proof of the first violation and the Board of Health orders from the first violation along with this violation, and we'll send all of that in a packet to the state, our regional folks, and then they elevate it to our State Department of Tax and Finance.
Just say, they know the place. I don't think they sell lottery tickets. I don't think they sell cigarettes. I think it's vaping products and rolling papers, and
Hey.
et cetera, et cetera.
Glassware.
Glassware, nice word. Okay. I'm not,
Nice, I like that one.
not saying it's, any less, I'm just saying it's not a
That's-
convenience store.
Yeah,
Not that it's road.
they're not selling groceries or gas. This
Right.
is their bread and butter, yeah.
But if they have 4
Postponed
points,
and then
then,
no show, that's,
yeah,
Mhm. Let's look at the names, two names are different, or one is the Bell lower paragraph, it's.
So one is the operator and one is the individual who was at the counter who actually sold the product. Operator employee.
That'll probably make someone sit up and take notice, $1,000 from you.
well, also, they've now have 4 points.
Oh, yeah.
There might be other things that are out of our control or their control now. It's warning the other people that you don't want to get to this step.
Would the information be included in the letter that they have 4 points and then it would be, it's gonna be referred to the regional office? It's all there.
Yeah, that's an automatic. We do that automatically. Mhm.
Yeah, I believe that was Mr. Ketchum's
Motion
suggestion also is to, are you saying to include that information in the body of the letter?
in the letter.
Yeah.
right?
And we certainly can, but so when we do, there's two different types of inspections that we do on these facilities. We do adult checks where one of our staff member will just go in and talk to an operator about what their signage is, what things need to look like, what, operating procedures they need to follow. So we do have those sorts of conversations with them about this is what it looks like to operate a facility in New York, and this is the type of repercussion if you don't follow the regulations. Like those conversations do occur with all of these retailers. So if they're paying attention to us, none of this should be a surprise to them.
I mean, I personally think it should be higher based on the amount of cost that gets spent with a no-show to coming in and postponement and all that, but maybe we can make that, or discuss some of those changes today. It sounds like that's on the agenda for the future, so that we're taking into account those costs.
Yes.
I don't know if we want to just be consistent on the list too. Does anyone have a motion, a specific, did you?
No, I did,
Propose
but I'd be
motion,
happy
or were
to,
you
if I-
just-
I'd make a motion to accept the recommendation of the hearing officer.
Or a second? Any further discussion? All in favor? Opposed?
I think I'm always in favor of providing more information to the person about what the current repercussions and potential future repercussions would be. Again, and maybe much of that's in a standard letter, but I think the more detailed, the better for everyone. Nobody should be surprised. It's not our goal.
Well, and then nobody can say that there wasn't multiple attempts of communication there about it. Yeah.
Maximum repercussion. Because you listed jail time. when
Yeah,
you were
there's jail,
reading,
there's
which
15 days jail
Wake
time.
everybody up. I
Yeah.
think. Not that we want to be scary, but.
didn't sip it by water.
Up to and including.
Before you folks move on, I just wanted to point out that there were two previous hearings and recommendations that you made for retail establishments that had sold twice within 3 years. And those licenses to sell tobacco and lottery have been pulled. So they have been suspended. There's a facility in the Dunkirk area and one in the Fredonia area that their licenses are currently suspended for a year.
Are they still? We're waiting.
They are because they have products, I mean, other than those items, I don't know what their future will look like by any means, but the suspensions went into effect on June 12th, I believe.
System work.
So who follows that up?
We follow up locally within 90 days of that suspension being in effect. We have to go out and do an adult check to make sure that they're actually abiding by that. And then, you know, depending on what we see in that first check, we are welcome to visit them as many more times as we feel appropriate.
If they're selling their products, they're still selling their products. They just wouldn't have a tobacco license in that manner.
I'm sorry.
If they were actually selling some of the illegal vapes and stuff like that under the counter, they're gonna continue doing that with or without a license.
Yeah, I mean, that's
Yeah, they
not
are.
something I can control.
Yeah.
Yeah.
But the lottery would, I presume not, the state wouldn't supply them with tickets, right? I mean, so-
Right.
So, I mean, that's
It's a
a
huge.
big
set, I
deal,
suppose,
too.
yeah.
Next on our agenda is new board member.
Yeah, so I will be happy to do that if you're okay with that, Dr. Kelly. So, actually, Ken Dahlgren with us right here at the end. That was a perfect segue because he was just talking, but so Ken, actually comes with a load of experience and Ken, I'll give you a chance too to talk more if you would like to about, but, Ken had actually been a former legislator, correct? And then also has worked in the area of, tobacco prevention, cessation, really systems, environmental change, and was really, I think, kind of at the center of, in the forefront within Chautauqua County of helping to make Chautauqua County, one of the first to go the 21 legal age. Number 3 in the state, okay? So there's a great track record there. So I am thrilled to have Ken as part of the team here, and just bringing that wealth of knowledge, still working in that space.
For another year.
Oh, okay. All right. Through Roswell, correct? And works closely with John Chaffee, and they really are tasked with a whole regional effort in the space of all things kind of inhalants, really. In a number of ways and more, inhalants, digestibles, the whole 9 yards. It does.
Well, yeah, except the funding doesn't, that comes with it, but.
Yeah. Right,
We're negotiating cannabis control.
right. So yes, Ken was just newly appointed to the board and we are very excited to have him. Anything you'd like to say?
Well, and I'm also a master trainer in diabetes self-management, pain self-management, diabetes prevention program. I did that. While in certified tobacco treatment specialist.
We are very lucky. Yeah.
And you're working with Roswell now?
The last 10 years, well, we worked for New York State pretty much directly, but Roswell Park is my official employer for the last 10 years. Before, well, for a while, it was actually the county in the early days, and also Boson's for a while, extension, last 10 years. Roswell's, and you just got 10-month extension and it's likely get another 5-year. I'm officially actually New York State employee.
think you were on my first or second board meeting. You gave a great presentation on all the different policy options that the county had to look at and compare to our Pennsylvania partners, other New York partners.
In the last couple of years, we have had our whole business a recurring theme battle.
Especially the licensing,
Yeah, I think this board has wanted to get some traction, yeah, some other things, so that would be good for future discussion.
and to be honest, the licensing issue is even more pertinent now than it was 2 years ago, especially with everything we're happening, because with cannabis coming in, the tobacco retailers have basically gotten so bold that I can walk into almost any shop and buy flavored vapes that are not legal to sell. And they're not, I can walk in the door wearing a 3-piece suit and they'll show me the catalog and I can buy it. And that was not that way until cannabis. And so it's like they're totally
Unfettered, yeah.
Yeah.
We'll have to get tobacco back on our agenda.
Dr. Kidder, did you have specific things to say about UV dental? Because if not, I can have it.
I have one more new business.
Oh, go ahead.
Sorry, there was something that didn't make it onto the agenda. I apologize for the late entry here. This is a request for a waiver from the requirement in the sanitary code that a single septic system and a single dwelling be on a single parcel. This is something that, let me just give you the little bit of background for this circumstance. These individuals called us interested in installing a septic system on a cabin that they have on this property. And we got out there and we realized that the cabin was a second dwelling. And it therefore, we couldn't just install a septic system to suit this cabin. They have a house that has a permitted system that's in good condition and standing. This was a cabin that had been built at some point, and they wanted to move forward with installing a proper septic system because currently what they have is not adequate. So when they reached out to us and we went out to do a site visit, we put the brakes on the whole thing and said, hold on, we need to talk about this further. We did take the step of reaching out to local code enforcement to ensure that code enforcement was aware of this second dwelling on the property, because that is something that we are trying to improve, is our relationships with code enforcement and our communication with, our supporting agencies in these different regulatory ways. So we have received confirmation from code enforcement that they are okay with the building. It's, structurally sound. They have a certificate of occupancy for that building now. So what this cabin needs now is a septic system. And you're certainly welcome to read the list of why they would like a variance from, or a waiver from the sanitary code requirement. Essentially, they have a property that sits very far back from the road. It's one driveway, shared utilities, all of these things being set up to feed both of these lots. It's a family lot. They never intend on splitting it. So our option, the option we presented to them was they could split the lot or they could bring it in front of Board of Health and ask for a variance, a waiver.
Are these people that came to our meeting? Was that a different?
These are different people.
Okay.
So the question is, they want to tap into the leach field they already have.
No, they want to build a separate
A separate-
field and a separate system for this separate dwelling. So they'll have two dwellings with two different systems
And the code says only one septic system per parcel.
per dwelling per parcel, yeah.
Per dwelling, per person, regardless.
Well,
of
yeah.
How big, how many.
Right.
But
So,
there is enough room to put in.
yeah, it's almost 18 acres.
Yeah.
Yeah.
If you're talking about a 1 acre.
Right.
Piece of property, 2 acre. I can't remember the one last year.
I think it was like,
It had to do with agriculture.
last year.
Yeah.
There's a big piece.
It was
Big
another
parcel.
big parcel.
They're trying to do the right thing.
And it's,
Yeah, I motion to approve a variance to, of this second septic.
Second.
Happen.
Any further discussion? All in favor?
Aye.
Any opposed? I do not have anything on UB then.
Because I was gonna say, I can just roll that right into my portion with the report, so we'll keep things moving right along. So, it is always so nice to be here with all of you and get a chance to see you. In regards to the report tonight, I figured we would start, first, of course, was my official welcome to Ken, to have him here. But then also, the topic of the sanitary code. And just wanted to kind of give a little brief overview highlight of that real quick. And Hannah's going to pull some slides up for us to kind of direct as we're going through this, to sort of set the stage and give a little context. Before we kind of dig into maybe next steps with reviewing the sanitary code and some options that we have there. So of course, the next slide is just reiterating our mission, of course, to prevent disease, promote wellness, and protect the health of our community. And how this board really does that is through the preemptive authority vested to you by New York State's public health law. If you aren't very familiar with that, these are a few of the articles. So public health law, actually, I carried this around with me a lot of times. I'm sure you all do too. This is a manual on public health law. It's a number of dozens of pages. Within the public health law, of course, if you're familiar with law and regulation at all, typically whatever governmental authority it is drafts law. Of course, you can't put everything in that law, and that law doesn't direct the operation of that law. So then from the law, then there's typically rules, codes, regulations, articles, guidance documents that come out of that. If you've ever been to state or federal offices, you'll see all of the old rules and regulation books lined up with hundreds in the bookcases there. So for the department here, the Department of Health here, and then of course the Board of Health, technically the Board of Health is really formed under a part of Article 3 in the public health law. So if you ever want to go there and look, you can read about who you are and why you're here. Article 6 is another one that's another one that you'll hear a lot about in the health department. That's really what governs the majority of our services that we provide, and that's what gets us paid by the state and not having to use local share to do that portion of that work. There's Article 28, there's Article 21, 36. I mean, there's a number of different articles, bits and pieces of it that govern the work that we do here. In combination with those articles, of course, are the codes, rules, and regulations. There is the New York State Sanitary Code. There's guidance in Title 10 around communicable disease surveillance, water structures, all of the different things that we do here at the health department. We then, from those layers of that tree, comes down to the local level. We have our own opportunity, again, as vested in public health law at the state level, to develop and write our own code. And that is the local sanitary code. That's what Dr. Burke was reading from tonight for us. You each actually have a copy, I think, in your packets, or no, we sent.
so there's just
Yes.
5, but we
Okay.
just to share.
Oh, there's a couple out.
Yep.
Okay. And if we haven't sent it, we will also send you an updated, or the most recent version of that if you don't have it. Within the sanitary code, of course, we can do anything in addition to what the state code says. We obviously can't do anything that is in contention with that. And we have figured that this would be a wonderful time. This group post-COVID is really back up and running at almost full capacity. We have a really great mix of experience, knowledge, different stakeholders around the table. So we figured that as part of kind of comprehensive planning within the department, it would always be a wonderful idea to review this code, maybe once a year or once every other year. Just look at it, make sure we're all familiar as new people come on. And as we were doing that, or as I was preparing for that and talking specifically with Jessica, because really environmental health and the community health through communicable disease really relies on the code the most in the daily work that they do. And we identified that there are some areas that really could be improved. Recently, we were with the Human Services Committee and in front of the legislator, and there was some expressed interest on behalf of some of the members of the Human Services Committee to, do we have the opportunity to, improve our enforcement and kind of beef this up a little bit? And we were so excited to hear that. In fact, we do. We have a sanitary code and we can update that. So as we're looking at this, when you look through the sanitary code, and we'll direct you to a couple spaces and send you home with some homework. But there is a permit fee sort of schedule in the back of the code. That's been updated by Jessica and her team within the last handful of years. So we feel really confident there that those fees are reflective of the expenses and things that are incurred with providing those permits. But we really have an opportunity to look at the fines section. And we talked so much about that tonight. So this is really nice timing. A couple of suggestions that we would have there as you go to read through this document. You can focus on kind of the first handful of pages, gives you the most general overview, provides all of the definitions as to what you need. And then it's broken down specifically by sections. And like I said, I'll highlight a few of those for you. But as you're reading through that, we would suggest, in talking with Jessica, considering approaching it through an appendix or appendices, as opposed to necessarily thinking about embedding some of these updates and looking at these fines within the text of the code itself. That will allow us to more easily update fee schedules and things moving forward without having to amend the entire sanitary code each time. We could just amend the appendix if we need to. And really looking at it from a fee schedule point of view, which again would allow us. Dr. Burke's got us going here for the meeting. So DJ services available now in the Board of Health. Could add that mix in. That might be fun. But really just in terms of, as we even talked tonight, there are some circumstances in which a $200 fine may suffice. But if XYZ variables, are in the mix, those things may elevate it to a fine that you'd like to see of something more like $2,000 or $5,000 or, whatever that max fine could be. So there could be a sort of flow chart fee schedule that would help you all navigate, the hearing, the hearing postings that are brought to you each session. What we would be prepared to do if it would be helpful to you. And Dr. Kidder, I think you were speaking to this a bit tonight too. We could work with our finance team to get you a breakout of what the typical expenses look like, per violation, but also maybe for a year. Expenses that would include the hearing officer fees, our county legal counsel, staff time and follow-up, that is incurred there. Typical overhead and testing that would typically be like your bacterial testing and your nitrate testing, that sort of thing. So that then really the fee schedule can reflect the true expenses and we have some justification there. This is really great timing in terms of, again, some of the evidence tonight with the patterns of neglect that we can see with some operators. Again, that fee schedule could be reflective of some of that. But also in gearing up for the lead rental registry, which will be coming down the pike. That will really be a kind of new undertaking that needs to be pretty thoughtfully handled in the sanitary code. So again, this is nice timing that it's kind of all coming together at once so that we don't have to revisit this multiple times. The other two areas that I just want to kind of put in the back of your mind, again, as you'll head home, and I'm sure eagerly, I'm sure you can't wait to dig into this, but really tightening up the areas specifically of the real property transfers. So that Article 3 section, that is a section that is specific to Chautauqua County. And so if you have questions about this, also to highlight as you're reading through these things, please feel free to reach out to Jessica in those areas. So she's really our internal expert on those sections of the code. So an example would be, you know, like a facility may sound like it's only a private property, but really it's a commercial property. And so there may need to be a different approach there in terms of some of the regulations around that. Oh, see, Marty, you're always on the ball. We've talked about that. There is some gray area there, but it really doesn't fall under our purview. It, along the lines of what you're talking about, is more so like kind of these event spaces that we wouldn't fall under our other like campgrounds, correct, Jessica? Campgrounds.
So Airbnbs don't fall under any of the current New York State codes because they are a unit rented out to a party. This is the world. You know,
It's not necessary.
well, that's the
Yeah.
guidance
I know,
that
I-
we've,
No,
yeah.
but I mean, something that I hear a lot about too, and I had actually asked Jessica about it
Yeah.
like 15 minutes before we walked in here, because, you know, the intent of what Airbnbs are supposed to be and the short-term rentals, that is what the state law is written for. It's the intent of it. But the actual operation of it, we know oftentimes people are stuffing many more people in there than what is reserved to be.
Well, and the temporary residence code was written in 2011. That's
Before
the New
really-
York State.
Yeah,
That's, I mean, these Airbnbs have really gotten out of hand within,
within that amount of time.
yeah.
So if it were something that the board wanted to take on and do something again more locally, we could certainly talk about those things at some, you know, at length as we go through the sanitary code. But that would also be then in consideration of if something ever did come about from the state, we would have to then most likely realign whatever we've done to meet the state standards if we are doing something in contention with what they end up deciding. But along the lines of that, there are other kind of similar rental properties that Jessica's team has become aware of, like these kind of historic barns and things that are now used for parties and weddings and things like that, that wouldn't be typically registered or permitted as a campground or a facility that's running bathrooms and multiple people coming in and flushing toilets and things like that. So that would be another space that we would need to, or another area of sanitary code that we probably should discuss and approach. So if you wouldn't mind reading through, again, specifically that Article 3 section, and those first handful of pages, acquaint yourself there. We will, in the meantime, between this meeting and the next Board of Health meeting, get you a breakdown of those expenses. And then it would be wonderful if we could come to the next Board of Health meeting and we'll send out an agenda and we'll work with Dr. Kidder. Perhaps we could break it down into digestible, realistic parts so that we aren't here discussing for 4 hours, and kind of take it piece by piece.
I think this is a great idea. I don't know when the last time the board might have sanitary. Sure, this isn't weird.
Well, that's what I was gonna say, is that every time we do an amendment, it has to go to the state. So we've made amendments here and there. But that's kind of what we're hoping is like, let's just do an overhaul.
Yeah.
So we don't need to
So,
piecemeal these
I
things out.
wonder if, you know, in our bylaws, the president of the board can't sign. Would this be better, something better to have a committee, board members, bring back to Board of Health meetings? The committee can, you know, there's a nice table of contents here that can be divvied up over the course of weeks or months. I mean, this is not going to be done,
No.
I would imagine, by next meeting.
No.
Probably something that's a 2024, 2025 type of, right?
Yeah,
Um,
and we have to get legal's approval.
Yeah.
So that will be a whole other layer. of
Well,
it.
and I
Yeah.
think, you know, when we did, last year, when we did the bylaws. County attorney was present.
Yeah.
So it may not be a bad idea.
Yeah.
And then they have a lot of work on their plate, but
Yeah,
the committee may not be a bad
Right.
option. In the event there are folks that people.
Right.
But there, it also has to go to the legislature.
it will have to go to, it has to go through multiple
Yes.
layers of
But
approval.
there's one other thing Ken remembers a long time ago, because he just mentioned it, we were third in the state to deal with.
Yes,
It wouldn't be unusual for us to be first in the state to
Exactly.
look at the Airbnb issue, because it's just burgeoning and we're getting, all kinds of things happening. And to put in some kind of something in there ahead of the rest of them, that's fine. And maybe it'll push the state along. If we can do something that's reasonable, but still get the process
Yes.
started, because this is becoming.
and a great
Its own
time,
committee,
Yeah.
probably.
Yeah.
That would be a big,
right.
big.
And I would say a great time to have the conversation and within committee to have Jessica as part of that mix in particular. One of the things to count for, again, this is kind of getting ahead of getting the cart before the horse. But as we add additional layers, and I certainly love to, the team's kind of learning. I love to be the first in the state to do everything, a little competitive about things. So would love to do that. And then just in consideration of staffing with that too, to have Jessica's team on board there. The lead rental registry is coming down at the same time frame in some ways. So that could work to our advantage in helping us leverage some staff, but may be a difficulty there too. Would want to keep that in consideration. So I certainly love the idea of, I would encourage a committee. And perhaps that's something that as you kind of do a general overview of the code, that could be established at next meeting, maybe some discussion about that and establish what that committee might look like and developing some of those next steps. So it gives you some time between now and then to digest some of that.
To build on what Dr. Burke said, even though we were third in the state back in 21, we did videos, we did presentations, the county executive, actually, I connected them with 7 other counties in the state that used our model for them to go. When we got up to a dozen or more, then New York State followed suit. And then guess what? It happened federally.
Right.
So starting here,
Yeah.
you can impact state and federal legislation easily.
Yeah. Well, and I always appreciate it. Having been on the state side of things.
Yeah.
If you can get there first, you tend to have set the precedents. And so then you can, as opposed to the state developing it based on a model out of New York City, and now you have to figure out in Chautauqua County how to retrofit it to make it work for your county. A lot of times they will take the best practice that they've seen emerge first. So, yeah, I think there's a wonderful history of that.
And this isn't the first place to look at Airbnbs and regulate. My daughter had one in her home in Denver. And they were
Okay.
regulated. I mean,
Yeah.
you have to have, there are all kinds of things, entrances, exits, and bathrooms. I mean, the city of Denver has, I think, some regulation based on.
Some of our Chautauqua County municipalities are starting.
They
Of
are.
course.
Yeah.
Of course, they're.
I was just, wondering about, one of the entities is probably going to be the courts, I assume.
Yes,
Then
they
they
have
would
to get a copy.
endorse the fee structure, right?
So we'll have to ask them about that. So typically, anytime you do an amendment or an update to the code, it has to be distributed to the court systems. I don't know if they have, or if they're a part of
When
the
it
approval
comes to
process.
punitive,
Okay,
usually they have to weigh in and endorse
okay,
and agree with the fee structure.
okay.
So I just
So
wanted
that
to
would be
throw that
another
out,
layer,
just in
yes.
my experience with code enforcement and the city.
Yes,
that when it comes to fees and fines, because those are punitive,
because they're enforced.
it's, and then for, yeah, that usually you have to be endorsed by the,
Is it punitive or is it?
it's.
Some
a
of them
fine
are-
that's considered.
If, yeah, the fine
No,
part.
it's surcharge.
We're not really doing fine. Surcharge.
Well, we do, so we have fine surcharges and permit fees
Mhm.
in sanitary code.
Yeah.
So there's like a
Fine
three-pronged.
structure
Yeah.
that we're bringing.
Yeah, but if it's part of the sanitary code, I'm not sure that that was.
It is.
In the past, we have not had codes.
Yeah.
Changes in the sanitary code fee structure.
Okay,
I'm trying, yeah, the conversations, because I've started having conversations with other directors about what they're charging, you know, so that we're not doing something ridiculous, but not
Yeah.
undercutting ourselves.
no, you're, yeah, the fine side of it.
But even the fine stuff, because my understanding is because it's falling under this jurisdiction,
Yeah.
it's ours to own.
Okay,
Yeah, we're not, you're talking about civil.
yeah,
and
it was,
This is
yeah.
the New York State sanitary code, and we fall under that. I don't think.
Okay,
So long as we don't exceed, because
Right.
New York State does set some
They
maximum.
set
Yeah, so long as we don't exceed
It's already
those.
set.
Yeah,
Yeah.
it's already set by the state, yeah.
Yeah.
Fine. and fees and
Which
surcharges.
would make sense in your experience because cities are oftentimes
Yeah.
exempt from health districts for certain codes and fees and fines and things. So Jamestown very much so could have have its own separate process, like New York City
Yeah.
has its own whole code. So
Mhm.
they get their own. But,
Are there, I see the fees in the code. I don't see an addendum fines. Is that-
There's not.
There's not. I
Right.
see. That's what we're.
that's what we'd
Okay.
like to kind of model
Right,
after.
so there's nothing to look at right
Oh,
now.
there is, page 5 has.
Yeah, it's
some
strewn,
language about fines.
right, it's strewn
Yeah.
all throughout the
Yeah.
text.
The
But-
idea of making this an addendum makes a whole lot of sense. You
Yes,
just
Yeah.
refer to see appendix A or
yes.
whatever, then you can change that much. Yeah, that's typically what's done, because you don't want to change
Text to code.
bylaws
Since
code
that
every time.
cap is already established by the state, we're really talking.
Yeah, we're talking about that range of where we want to be.
We
Yeah.
can't exceed the state
Right,
maximum.
all right, yeah,
Or,
that's,
I'm not sure about
Yeah.
the minimums, that's up to the hearing officer, but the state sets the maximum.
yeah,
And
okay,
then really more so in building kind of a fee structure, so almost like a if this, then that type model, where it would be very easily navigable for you all as members and for the hearing officer to see that if this is this sort of fine, they've had this many violations within a year and it's been elevated to this point, then it would be a 15.
Algorithmic, we don't have to.
And for the
About the
operators.
subjectivity.
Yeah.
The operator.
Yeah, and for the operators, so that they understand that, look, we'll start and we'll be as nice as, you know, as this allows, but
Detriment's gonna take all your fire fee's gone. Take it right there and write it.
Well, we'll just draw this
Good.
process. He can be on the committee and we'll draw this
That'd be
process out. for
The algorithm is great.
Yeah.
I do want to follow one thing, actually, I believe it was you said. You start thinking about, you do something and you design it, and then you have the issue with the courts. I don't live in the town of Dunkirk, but I will tell you, they spent over 2 years trying to design something about Airbnbs and permitting and all this. And one of the owners of an Airbnb sued them, and the judge upheld the building owner. So, I mean, they spent, years, it might have been 3 years, and tons of meetings, public hearings, on and on and on. And they got sued and lost. So, you're careful of exactly what we're doing.
Yes,
and-
'cause, yeah, ours would
and What our
be-
scope is.
Yes,
Well,
ours,
and so some of these
Yeah.
things, I mean, since we're on the top, the first thought would be a septic system designed to handle the number of people that the facility, because
yes.
like
Yeah.
that
Yeah, that would
that
be
is
our-
under us, but it's just,
But you
none
still
of
have
these
to
Airbnbs
define
are
right
doing
what
it.
it's-
And who
what an
determines how
Airbnb
many
is,
people-
and what's a temporary rental, a temporary dwelling, how many
Yeah.
duration, I mean, it could, I don't know.
Yeah.
Yeah.
Because who does it apply to? whatever the rule is that we, right? So, I mean, it's complex,
Yes.
but it should be done. And also that point that was raised about the old barns that are wedding venues. So an old barn, but you have 200 people in there.
Yeah.
Yeah, occasionally.
Or sometimes 2 days a week, May through October.
Yeah.
There.
Yeah. And unregistered basis. So,
Yeah, I could see those being big issues.
Well, it becomes a big issue when it hits a fan, there's a fire, there's this, there's that, there's a, all it takes is this one thing to go
How many
wrong. in those
porta
places.
potties?
right,
Yeah.
exactly, yeah.
That's right.
Or,
Right.
or none, and use the overloaded septic system.
Yeah.
And those venues do tend to be not in municipal centers where there's sewer and,
Right.
water. So it is very much septic, thing. So.
And well water.
Yeah. Water.
I own a home that I rent out. And one of the typical questions I get is the water safe? And the people that ask usually do not have a public health background, so I can fudge my way through there, but I do want to do more. And I am not regulated in Pennsylvania.
Yeah, they probably also aren't used to, wells and stuff. Wells, they don't get their water.
Exactly, they're
Yeah.
city folk.
Yes, yeah,
And to them, that is a really foreign concept to have a well.
right. Okay, any other questions or discussion there? So next time we could come prepared, having reviewed this and make some recommendations for a committee per Dr. Falk's suggestion there. Okay, wonderful.
So we're reviewing Article 3 and whatever you're gonna send us on.
Yes,
Fine.
and Article
Okay.
3, was there some, yeah, the entirety of Article 3 really, and then,
We
there's some other
spend-
spaces.
We spend a large amount of staff time on property transfer inspections. It's a very, in my opinion, worthwhile endeavor because we find a lot of garbage septic systems that we're able to call out and require corrections for. But it's something that Chautauqua County does. Erie County does it to some degree, Cat County does it to some degree, but it's not something that's done around the state. And I think given the importance of the water structures that we have in this county and our proximity to so many water structures, the property transfer inspection process it's a really great asset to this county. And it sort of gives you guys an idea of like the type of framework that we can put together as a county agency.
There's a concern though, like those been in families for 80 years, and then all of a sudden.
There's exemptions.
Yeah,
Mhm.
because there can be
Yeah.
a lot of that around the lake,
Mm-hmm.
you know.
Yeah,
So
exemptions.
there's no
whether
required
there's-
testing unless you.
Well, no, if you transfer
It's
to a
any sort of
direct
transfer.
property, no, if you transfer to a direct immediate family member, that is exempt, so we don't go to those properties.
That's-
So,
That's what she said.
yeah,
Right.
Yeah.
so that would be something,
We could consider.
I'm sorry if I misunderstood, yeah.
So Article 3 is basically those scenarios that Jessica was talking about, so you can read through that. And then the first handful of pages gives you kind of an idea of the narrative fee structures as they are now. Reach out with any questions in the meantime, as you have those. Happy to answer in the meantime. And kind of keeping with the topic of sanitary code, something that I did not get written onto the report. So the director's report is in your pile of papers there if you haven't found it. Jessica's team has also been in the news a little bit too. So I just wanted to throw this out here for all of you. There are some media stations that just get a hold of the regular reports that Jessica's team does in regards to food establishment, basically monitorings that occur. Yeah, not as bad. Some people have seen it on Facebook. Okay. So these media outlets, this is public information and it is posted our website, right? We actually
We have
post
a link on our
to-
website about how the public can find it on the
Right.
state's
It's the
website.
state's website. We turn in all of this reporting. It's always been public information. Other states do much more even than what we do, and they assign grades and all of these different things to it. But this is very technical language. It's sanitary code driven language. And there could be what a sanitarian would go in and see as very minimal issue, but it reads in a very scientific way and it sounds very scary and all these things. And so these news little affiliates are grabbing this information and kind of putting it in a slightly different context and pushing it out. And now it has been circulating on Facebook pretty widely. I'm never really on Facebook and I'm even seeing it. And it's a lot of community discussion and talk. My kid's school cafeteria is on this list and this is, ridiculous. And there will be things like most kitchens are supposed to have pest control measures, so they need to have mouse traps and things in there. That might be a violation that they didn't have a mouse trap in, one of the areas of the room. It could be as something like that.
So again, the problem is that the public information lists the general category of the violation.
Right.
The reports that the operator receives from my staff has very detailed. We saw Kevin serving this at this time from this, blah, blah, blah. So those very specific information doesn't get made public, rightly so. But then these categories
Sound egregious.
are open to be interpreted
Yeah.
however the reader
And
All
chooses
it
to
says
interpret.
for rodents is insects and rodents present.
Right. So
And
that
so
could be, I found a mouse
it-
trap where it shouldn't be, or it could
Yeah.
be, you have a nest of something.
Right.
And it's,
Yeah.
so that nuance.
So
is
it's definitely
conveyed.
what would be called clickbait on the internet. These organizations are using this to basically drive traffic to their sites. So just wanted you all aware of that, and also as you hear things.
I clicked on the thing that came on my phone. I'm like, I'm on the board of health. I don't know.
Exactly. Okay, good. So this is good information for you. And just if you get questions, but you can rest assured in knowing that there are very specific protocols that the sanitarians follow. If there were something egregious, so that they're handling that, and there's protocols for all of that.
And we are not supplying the media with this information, because
Right.
that's what some of the operators have been pushing back on staff, saying, why are you blowing us in? We're not. We are reporting to the state the same way we always have been. It's just that some very industrious reporters have decided to make this a monthly segment or whatever they've chosen to do.
In the vein of communication, and I know Jessica was speaking to this too, this is something that we've put at the forefront of what we're doing, is really being a partner and technical assistance to these organizations and our property owners and the constituents and residents that we serve. And so there is a letter that is going to be delivered with each of the inspections that in, this temporary amount of time just explains exactly what Jessica and I have just been explaining. We're not providing any sort of, additional information to media outlets or anything like that, blah, blah, just so that the operators feel supported by us and that this isn't something we're doing to undercut their business. And really how we are and have been approaching the businesses as we go in for the inspections is to say, we are here to help you so that you don't get to a point of egregious violation, because a lot of times restaurant owners, if you've ever worked in food service, there's a lot going on. Things can go by the wayside. You can miss something. And so we're here consistently to ensure that you never get even close to any of that, help you along the way and mitigate any of those issues.
Just a quick question, what made it into that report? Were those basically a notice?
So we have two different categories of violations. We have red violations, which are
Yeah,
real.
right. Okay,
Yeah. And then we have blue violations, which are concerning, but of a lesser nature.
It can be
Um,
rectified fairly
Right.
quickly.
So yeah, red violations would be something that are really, really likely to make somebody sick. And then blue violations are something that, speaks to sort of general maintenance, cleanliness, upkeeping, but isn't necessarily something that's gonna be a major problem. So things like barehanding foods, that's a red violation, that's a problem. But then other things like if maybe they have a personal item, like their personal drink is stored on the same shelf as the crackers that they're serving with the dinner soup or something.
Yeah,
That's a blue violation. We have to cite it because personal stuff shouldn't be kept on the same shelf.
Surfaces.
But let's think about what that's actually
Yeah.
likely to do. Yeah.
These things don't come
Thanks.
to us as a board, right? We're just talking about.
No, not unless somebody was in violation of something where they were asking for them to rectify something and they didn't, well, then it eventually would make it to you. But again, this,
But this is not
No.
unusual. I
No.
mean, you look anywhere, I can remember there where I was and you see a list of red violations and blue.
Right.
This
Right.
is all just,
Right.
that's out.
well, and like I was saying, in Massachusetts, there's a grade that's posted right on,
Yeah.
on their restaurant, like
Yeah.
you know, people walking in.
Yeah.
I mean, so this is a very, yes, kind of typical, easy process of things. Any other questions or clarification there before we keep rolling? An update on and next steps about the pediatric dental services that we talked about before. So again, just a quick recap. UB Dental School has for a handful of years now provided dental services basically to a Medicaid population, pediatric Medicaid population in the county, typically serving just over 1,200 children a year in Chautauqua County. We did receive notification that the initial plan is to pull back that resource to inner city Buffalo. So there is a group, including Dr. Pender, who will be on a call with the dean of the dental school on Tuesday, July 30th. If any of you are so inclined, you are welcome to join. Please reach out to us and we'll get you the invitation to that.
Lacey, this was a 12-month program, not just a summer program, right?
It's technically a 12-month program. Over the last, I'd say probably 5 years, 5 to 10 years, it's become primarily a summertime program. Just by way of, again, their difficulty recruiting students to come all the way down here during the winter time.
They operate year-round at school partners.
Yeah.
Do we know, is any of this information confirmed outside of that one individual?
We did receive other information. Yeah, from the dean's
But we're
office.
gonna find out July 30th.
Yes,
Okay.
and then in the meantime, we'll also be reaching out to the school superintendents, the specific ones who this van has visited their school regularly with basically a letter of support they'd like to sign and supply that as well. But we figured, especially with Dr. Pender in the mix, we'd have a conversation first with the dean to see if there could be other arrangements made there. And I have started some initial discussions with Mike Peace of the Chautauqua Center. And we had pulled together a group as well to talk about some initial contingency plans. If there is no way that, we'd be able to salvage this.
Is it primarily money or staffing?
We will
Okay.
ask and we will get the initial reports that we were getting from the program manager of this program, who it sounds like she'll be leaving the program soon, is her time. She will be leaving. Resources in regards to this has been funded primarily now through a Mother Cabrini grant, and Mother Cabrini, as our most foundations, would like to not continually sustain one program. They like to diversify at times, and had been for a number of years a line item in the state budget, and that appropriation has gone away. So Senator Borrello is on that part of the discussion.
Going next.
And so what has been cited as the additional primary causes outside of the funding is also just the people resources to staff it and wanting to keep that more local, because of course there is a need in the inner city Buffalo as well.
It's the other huge potential funder, and they have particular interest in kids, is Ralph Wilson Foundation.
Yes.
And maybe that's all being explored, but, but they've got, as I like to say, our very public North Shore Community Foundation, is they have a big problem, the Ralph Wilson Foundation. And it should be our job to help solve it. That is, they've given away hundreds and hundreds and hundreds of millions of dollars, and they have more money now than when the foundation was formed. And unlike any other foundation, or very few foundations, it's a spend down foundation. They have to get to zero within like another 12 years or something. And they've got billions, big, I mean, they've got tons of money and they have to get rid of it.
Well, we will be happy to.
We have to help them. We
Yes,
have
we
to
will
help
them.
them solve their problem.
And so, and I think to your point too, I know the group that had met in regards to some contingency plans, we certainly are, more than happy to and understand the need to ensure that a service like this continues in the community. So it would be more so, again, seeing what level of participation they'd still be willing to have and just getting a gauge of what resources and assets we do have at our disposal, so that we can get that strategic plan in place to ensure that this continues in the future. It would be wonderful, of course, if it doesn't have to land in the health department, but we would leverage our staff resources, our grant writing abilities, things like that, to keep it going in the meantime while we work with community partners to sustain it.
We have two mobile vans that can be put in this community. We just don't have identified dentists.
Yeah.
Yeah, and
Exactly.
that vehicle has 2 pediatric dentists, which is incredible, because when students come on board, if there's a pediatric dentist present, they can perform all of the treatment without the, and they have 2 that fill a full time for the. Now, can we put together a number for that meeting of children in our county, maybe even in Allegheny and Cat, that have Fidelis really? Would we be able to get a number?
Yeah, we
to
should,
tell them?
we should be able to.
Yeah,
Yeah,
The
through
need is-
DSS.
just to show how big that need is.
Maybe even from Fidelis. I think it would,
Yeah, we had that one
Yeah.
representative at that meeting.
Oh, yeah, she was there too.
Typical
Yes.
B, it's like 50%.
Oh, yeah.
Yeah. Yeah, and just in terms of what, the average number of children that were being served, I mean, 1,200 alone there, and that's untapped, there's other untapped communities there.
How much is the grant? September 15th, dental, freedom,
Yes,
GCC,
yes.
who knows about it? I'm getting concerned.
Oh, all right.
Yeah.
Yes, well, and actually, that is also on my list to update everybody about. We can send information to this group because the RAM Clinic is also looking for help and volunteers. So if you're not familiar with the RAM Clinic, Remote Area Medical, it's a model, really an international model. It was recently in Olean, been about a year, and now they're bringing it to JCC. JCC, Chris Schuyler, actually, in combination with a few other partners, are working on a September 14th and 15th, I think, yeah. Yeah. And the health department will be there in some capacity, providing, what services we're able to. Just so in case you have organizations who are interested, so for TCC, have they talked with you all about it? I'm sure probably, yeah. Some of the difficulty that we run into with it is that really technically there's supposed to be no intake information. So then in order to really provide any meaningful data and documentation that we were there actually doing work, it's difficult for us in some way. So we're figuring that part out. But that was just sort of a side plug there. Any other questions before I move on from?
It's the 14th set up on the night.
Okay, perfect.
I'm not sure if you guys have been talking to the RAM program, because I've been calling a few times to get more information for my staff. Do you know what the follow-up is? So we go and I perform whatever, hundreds of extractions,
No follow-up.
but what happens to those? So those people who have pain though, the next day, where are they gonna go?
Nowhere.
Yeah, that's.
Yeah.
Yeah.
No, there's no follow-up and there's no intake. I mean, so really you would have no medical history. You wouldn't be able to look up. So it's what you see, what you can do, you
Yeah.
provide and they go.
I've participated in a few, but I went
Oh,
to Tennessee for that. I've never
Okay.
done it in my.
okay. So to your point though, one of my initial, because I have some experience with RAM in previous work and for locally, there clearly is so much that we could be doing, with RAM locally and so many people unserved and unconnected. My big thing, although I'm not directly in the talks, Dr. Falk and Kathy are, my request was to ensure that we have some basically care coordination there, to your point, to say, here's our FQHC down the road, and here's local provider lists, and here's who, will accept Fidelis insurance and things like that. Because of course, as the health department, we're concerned with their continued preventive care that they would receive. So that's a very thoughtful question. Dr. Pemke. From there, in kind of speaking in this vein of things, wanted to give you a quick update on the mobile health vehicle. Kathy Burgess's team through Community Health has been running a summer pilot. They established a schedule with community partner locations and revisiting those locations on a reoccurring basis, providing outreach and education, lactation and breastfeeding support, harm reduction supplies. The plan is to expand to some identified school districts within communities of concern to provide catch-up immunizations and eventually some lead screening and testing there as well. As part of the pilot, of course, we're not trying to necessarily gain a mass of numbers at this point because we're trying to develop the best practice of how we do this well, how to market this, how to work with groups that will help get us in touch with people. But even then, with the 10 events that they've done so far, they have been to 7 unique or unduplicated sites within those 10 events, served over 30 clients within those events, provided 23 vaccines and basically 45 outreach touches with things like providing condoms, Narcan, xylazine test strips, things like that. So they are building that out and had some great feedback, and the Human Services Committee also had some encouraging words there that they've been hearing from some constituents that it's been very well received in their communities. Any questions there before I move on? I'm keeping it rolling so we can get out in some of the daylight here still, so get some vitamin D. Strategic planning and our 2025 budget preparation. So aside from the typical strategic planning that we are doing as a department, in terms of organizational charts and things like that, we've kind of set a focus on informed planning within our departments with an emphasis on leveraging the intradepartmental partnerships. So again, lead is a perfect example of that. We have our sanitarians and kind of a housing approach of things. Jessica and Kathy have been working together to bridge their teams to bring the nurses more so into that fold and mix to go out and do outreach education within the doctor's offices, follow-up calls with elevated blood level children and families, just becoming a nice partnership there. But that, of course, takes a lot of time and planning to get people's schedules coordinated, funding sources braided, the whole 9 yards. So the team has been doing a really wonderful job in those ways. The other thing we're looking at really building into the infrastructure of what we do is consistent assessment and evaluation framework so that as we kind of take on these new projects and new areas of focus, we can ensure that we're actually being successful in the ways we hoped to be successful. Of course, we are always happy to serve one person and have that be a successful outcome. But really, as the public health department, we want to ensure that at the community and population level, we're achieving goals and moving metrics and really delivering in ways that are meaningful in the community. So it's a heavy lift in some ways for the departments, the divisions to be working in this area, but I can tell you, you should have a lot of confidence in the divisional staff. So when I say divisional staff, environmental and community health, basically, because while this has not really ever been a formalized piece of what they do, they're already doing all of the things. They're collecting the data well, they're documenting well. There's great communication with the supervisors and their staff to bring all of this together. The bringing together part is what we're going to build in and really develop that as just a nice infrastructure within the department. And hopefully the legislator will appreciate that, and you all and the community members to then be able to see that data and see those outcomes come to fruition. Staffing, of course, our staffing plans and preparation for the budget is something that we're working on right now. We're working to continually stabilize amidst the staffing challenges that are being recognized at both the state, national, and local level. We are seeing a little bit of a strain in some particular areas. There are some creative programs that New York State has put into play for state, for local agencies, but also the state agencies. It's called the HELP program. So we have presented this to leadership and HR. We're hoping at some point that they might be able to sign on to that. So a number of the other counties, actually almost all of the counties in the state, are utilizing the HELP program. And what it does is it allows health departments and other critical human service agencies to sort of circumvent the civil service process in order to get skilled staff in the doors without having to jump through a number of the kind of red tape hoops that come along with civil service. But they would still be recognized by the state and we'd still be able to reimburse for their time. So we're looking into creative strategies like that and hoping that come to fruition. We are working on orienting our current and future staff to the framework of the departments. Jessica could probably tell you that they have so much work on their plate all the time that they aren't always afforded the opportunity to learn about all of the articles and public health law and the structures and all the different things. So we're working on doing that as a part of our staff development so that our staff really understands the purpose of what they're doing and why it is meaningful, and that there is some support for them at the state level. We found that that does give them a little more confidence in going out and doing this very difficult work. Recruiting new talent is something, and succession planning. We will have a handful of nurses in particular with a wealth of time and experience here at the county retiring within the next 2 years. So we are working on some of that succession planning and trying again to work within the civil service structure of hiring to get as many people on board as we can to be trained well in these things before these others leave us. But budgets and FTEs can be difficult to justify if you have 2 people, in kind of one position. So we're trying to navigate some of that. And one of the ways that we have been able to do that, we are very excited to announce that the New York State Fellows 2.0 version the 1.0 version was a success in our county. And we were able to secure 4, even though we were technically only allotted 3, but we were able to secure 4 fellows to come and join us for 2 years in the health department. Their time and wages, benefits will all be covered by New York State. So no local share or local taxpayer dollars. There's federal taxpayer dollars that you've already paid into this program for, but it's coming down through the CDC, through the state to us. So we, the group just finished interviews this last week, selected their 4 individuals. They'll be working in all of the different areas of public health, and the division directors have already developed the plans and projects that they'll be working on. These are typically things that we may never get to and may never get to do in a way that we would consider our most excellent work. So we're really excited about this. So you'll be hearing more about them, and I would love to have those fellows come and join us at a Board of Health meeting so that you'd be able to meet them as well.
I think they'd be interested in sanitary code.
I know. So very interesting that you'd say that, because as part of the communications division, it is policy development that we wrote into that. So we were thinking ahead about some of these things to help support you all too in some of this work. So yes, that would absolutely be a wonderful part of that committee. And then lastly, part of this section, the lead rental registry too, again, is part of kind of this great recruitment effort that we're trying to do. There is money that's coming from the state to support the additional staffing needs that will be needed for this. So Jessica's team is approximating about 6 at this point, new staff that would be added, but again, all funded through New York State. And their team is also working hand in hand with the city of Jamestown, who is building out their own little more comprehensive housing registry that also includes lead. So that we are doing this in concert with one another and really doing it in a comprehensive way, not duplicating in any services there. So I'm very excited and very proud of that work that Jessica's team is doing. And then just lastly, on some of the funding updates, the health department is in some ways working on some opioid settlement fund things. So I know we've talked about that before. We just want to keep you updated there. We are really not the forefront agency of that. Most of that is flowing through the LGU, through mental hygiene. Dr. Falk does a lot of work on the jail medical side of that. So there is some money that of the opioid settlement money that flows through there. And so he's been working hand in hand and helping me along in the mix too of figuring out where all of this money is coming from and how to organize it. And if there are opportunities for the health department to be a part of that, he and I certainly have talked that we would be more than willing to help direct some of those funds. Because there is a lot of work that we do in the health department on the prevention side of that. So you could stay tuned. I'm sure you'll be hearing a lot more in the community about those funds. Also dual settlement funds that are flowing down to counties and school districts. We are hoping that the health department will be in the mix of that funding as well. So Ken and John, the work that they do is very much in this area as well. And so we're all kind of in concert working in this area. So that may be some more settlement fund dollars that you'd be hearing about from us, the health department. And then just lastly, to highlight a couple things here, because I think it's always nice for you to hear about the good news too. This is a group that has to do a lot of enforcement, but just within the last couple of months, so June through August, so basically the timeframes that, meeting to meeting between our meetings, the department has either been awarded or anticipating awards and grants of over $2 million just within those months. And that is money outside of our state aid and reimbursement. These are funds that are brought in by our staff, which again, they are not technically planners. They don't sit in a planning title, but have assumed these roles and taken this on to help offset the cost to residents for lead remediation in their homes and prevention, breastfeeding and lactation programs that aren't fully funded at the state level. And we're bringing grant money in to ensure that that work happens in a comprehensive way and we don't have to ask for more local share. So I just would be remiss if I didn't highlight the exceptional work that the staff is doing in that way. A number of those dollars, just because it looks like a big amount, a number of those dollars actually are passed on to community-based organizations who do boots on the ground work. So, we probably wouldn't have any staffing issues if we had an extra $2 million laying around every couple months, but really that goes out to the organizations like CRIC and COI who go in and do the remediation in these homes and things like that, liabilities that the county wouldn't take on themselves. Yes. So really Kathy, Jessica, and Anna and Sherry and Wendy really are the ones at the forefront of making all of that happen. In terms of events and updates, instead of updating you on a million of those, would you follow our social media pages and find them there? Like and share our events. And then of course, Sherry has been working as part of her work in that Central Division of Administration and Communication, has been updating within the confines of county website platform, updating the website to make it a much more interactive, more user-friendly website. So
Not
there,
so many rabbit holes and branches.
right,
Yeah.
not so much words.
I remember just like clicking on one link to another, like, have my
Yes, yeah, okay, so have you noticed it's much better, Dr. Kidder? Yeah, so please, feel free to go there and navigate, click away, find great information, ask questions, or of course, provide suggestions. We do basically rotate a section of the front page of that website to whatever is most current, kind of happening seasonally or things like that. So if there's something that you feel should be advertised there, like, turn in your water reports. Otherwise, it's a $5,000 fine. We could put that right on. But anything in those regards, please let us know and we would be happy to include that. That was a lot of fast talking that I did to try to get through that report. Any questions or thoughts, ideas?
Just out of curiosity, do the opioid settlement funds and jewel settlement funds come with specific earmarks or stipulations exactly how they have to be spent, or is there some wiggle room within the
So
county?
we don't know about the jewel settlement funds quite yet. So that's very good there. The opioid settlement funds, so it depends on where they came from. So half of them came down through Oasis. And there were basically 7 pillars of recommendations that the expenditures had to be. So some of them were prevention, transportation, housing. So there's very specific things that Oasis would. The other opioid settlement funds, not so much. Those are the ones that came directly. And they're about half and half. Well, in total, just over $2 million. But those ones really didn't come with as many specifics. Although we are really trying to take a look at Sutton County now. Really trying to take a look at where do we get the best outcomes? Where do we get those? That's what we've been working on, Steve Kilburn, through CSARP. So CSARP is really functioning as the advisory board for the Oasis funds that came through the LGU. But that board is also comprised of a number of stakeholders and community organizations that provide some recommendations of how those funds should be best spent. So, so we are leveraging those individuals. So it's definitely it's a moving target. It's evolving. Unfortunately, we did have to employ a large amount of the opioid settlement funds to cover the medication assisted treatment program in jail 23. Those funds are not going to be as many come 2025. So coming into budget season now, we've been paying close attention to how we're going to fund medication assisted treatment program at the jail. We have probably an $800,000 a year budget for that, for expenditures. So it's a big price tag service. So
Yeah, and with that too, I think it's an interesting question to Dr. Kidder, because as you look over time, as settlements used to come out, there would be basically no boundaries on it, and municipalities and counties would take what probably should have been used to prevent or mitigate further issues of whatever that issue was, without any strings attached, to be like, we'll fill potholes in roads and we'll do this. So typically you do see now the settlement funds come down with some sort of structure. Dr. Falk explained the 7 pillars there, the jewel settlement funds. Yeah, pretty early on, it speaks mostly to prevention. So that's where we feel like within the health department, of course, we're pretty poised to be able to take that on, that work on, and do that well. But it depends on, it's government, and bureaucracy. So as defined as it is in one way, it can be very broad in other ways too. So I think that's been kind of a lot of the work that we've been doing, where Steve has been integral, specifically on the attorney general side of that money, that second half of money that Dr. Falk was talking about, to just really set some good purview there for us, because otherwise we could get out into a number of different ways and you could easily go through some funds. Yeah, that's probably how it was.
Securitized and paid off the debt, and then guess what? The debt appeared within a couple of years. The money was totally gone.
don't go.
Yeah, I know. I know.
Triggering, past trauma.
Oh, yeah,
Okay.
it's still trauma for me.
Yeah.
What happened there.
That was a lot of money.
It was a lot of money.
Yeah, that was.
And the state is still wasting the $1 billion a year they're getting from it to this day.
All right. Anyway,
We hope to present some of that strategic planning to some of the specifically the heat services going to be the next couple of months. You know, in regards to opioid overdoses, we are seeing a very encouraging 6-month trend. Over the last 4 months, we've had 50% less, or 50% fewer fatal doses. So it's
Then
pretty
for
remarkable.
2023.
Yes.
Wow.
Compared to last year. this time. So the significant 6-month trend, 50%.
And also
Fantastic.
different from Erie County, right? Because Erie
Yeah.
County is double what they
Yeah,
were there
most
for.
adjacent counties and other counties have not seen. this. In fact,
Of course, that's localized really to one area. Jamestown hasn't changed. Dunkirk did.
Right, yeah, that's true.
Yeah,
Yep, it's county.
Jamestown was flat. Dunkirk, boom.
But we'll even take the flat.
No,
Yeah,
that's-
it's gonna go up.
Yeah, we'll even take the flat as the
That's-
winner.
that's the- That's the things we have to figure out.
Yeah, very good point.
Why is there that trend?
Oh,
And is the trend long enough and are the numbers big enough to really mean it's a trend or are they
And some of the-
aberration?
yes.
I don't know.
Yeah,
I'm trying to be negative, but
Well, and I think Dr. Falk's like, we've shared in these groups at this point, we haven't done any major press releases and things for those reasons. And there's also that, you know, that window of time that you have to consider that there is a user base in these situations where that could be reflective of, you know, a number of the users have died previously. And so maybe there's not as many users at that time. So all the statistical regression things, we're gonna wait a little bit and then to your point, and then
because then you got to report if it doubles again.
exactly,
You
but
gotta be careful.
But what we're, but very much in particular, you know, to Dr. Falk's point is to say to these groups, you know, hey, keep your eyes and ears out
Yeah.
and things that, you know, let us know of these, you know, these ideas and things like, yeah, they have the methadone clinic because that's what Steve really is here to help us with, is to then kind of start tracking some of those trends and can we see something
Yeah,
that actually is,
works.
you know,
Yeah.
significant out of
Great.
this. So, yeah, so we're celebrating. We're celebrating that.
Sure, yeah.
Just internally. Yes.
Are we, is that the?
That's it
we are
for me,
done with
thank
the
you.
Director's report. There's one other additional item on the agenda here that says group photo.
Yes, so Sherry was hoping that because there are a number of new people to put on websites and marketing materials and things, although if we are going to use it publicly, I'm sure she'll reach out to you in the consent form first, but to just have a photo on file if everybody is amenable to that. But we are missing Dr. Khan. So he's gonna have to be photoshopped in.
Longest tenured, board members.
Yeah. So would you all rather wait for another time? I know, Sherry was like, Lacey, you
We
aren't
could
gonna
do
like
one
this.
now and then do one if we're all here. 'cause
Okay,
What
I
if we're
think that's a
never
good
all,
idea.
we're
Exactly.
never gonna have the full constellation. of
Actually,
it.
Sherry's very good at photoshopping.
She really could Photoshop him in, I'm not
Do it.
joking.
We should just take one every meeting and.
Okay, so Hannah, did she task you with that or? are we supposed to
She's
get
good.
her?
I'll go get her,
Okay.
because yes.
You know, the directions have a
Just as
different
a
project.
FYI.
When Stalin
I don't
had
think
his
you
purges, they
want
had all
these parties
these posters of all the Politburo. They had to have
It's
artists
specific to it.
Photoshop
I got
and paint out
these like
the guys who
over that already. But if they have that
disappeared.
conversation.
And these
with
guys
another
are really
person,
good at painting in
If for any
background, and
reason-
taking people out.
you know, they don't have
And
the contact.
these
because
large posters have
foundation. The,
larger and larger
They
areas
have-
that now have
They,
background.
Wilson
Because these guys were
as
really
a
good at-
director of Western New York. and-
Shall we say,
I don't know if you know that.
take it away.
So, but I also,
No.
The
Okay.
graphic arts
There's
and stuff I need.
you go there.
Say if
So you
it's
get
a
careful.
press of a book.
I
We
would
need
rather-
a, we need a, Dr. Kidder.
That's why they
you're
asked
gonna
us
need
to-
an adjournment.
Yes,
Financial
can I have a
resources
motion
or
to
is it
adjourn the meeting?
human resources?
And
And it's always both.
Oh, but our
And what
note
we're-
taker.
I'm going,
Oh,
hold on.
he's coming.
Yes, we would like to adjourn first and then go to a second. I think that would be the best course of action.
Can I have a motion from someone to adjourn the meeting?
Yeah.
So
She's saying that he
Dr. Cron?
is saying
Seconded by-
is.
I don't think you need a second. for
Who
that.
seconded? I'm
No,
sorry.
just Somebody, someday I'll remember that role.
Right,
Yes.
right.
Oh, thank you.
Yeah.
So that's why we're gonna meet with them.
Yeah. Then we'll
Really
find
get
out what,
insight is-
what the pressure points are. 'Cause I mean, I think
Yeah,
we're-
right. I think we're going to be in the,
Wilson Foundation.
yes, okay.